Good afternoon, and welcome to the 4th Diagnostic Leadership Summit. We are now heading into the panel discussion on Diagnostics Roadmap 2022 from CEO's perspective. We are pleased to welcome Dr. Sanjay Arora, Managing Director and Founder, Suburban Diagnostics. Welcome, sir.
Thank you, Kanchi. Thank you.
Dr. Pankaj Shah, Chief Executive Officer, Aspira Diagnostics. Welcome, sir. Dr. Arjun Dang, Chief Executive Officer, Dr. Dang's Lab, who will be the session moderator for the day. Welcome, sir. Anindya Chaudhary, Chief Operating Officer, Aster Labs, India and GCC. Welcome, sir.
Thank you.
And Mohit Lalchandani, Director and Chief Executive Officer, Dr. Lalchandani Labs. Welcome, sir.
Thank you. Thank you so much.
I now hand over the session to Dr. Arjun Dang to take the discussion forward. Over to you, sir.
You're on mute, Arjun.
A very good afternoon to everyone, and a big thanks, Kachi, for the introduction. It's a great honor and a privilege actually to be hosting today's session. And we have very senior stalwarts from the diagnostics space and also young entrepreneurs and success stories who have joined us on this panel discussion. And actually, when Elets reached out and they were planning to have this panel discussion, I actually opted in for moderating it because I have personally had the privilege of interacting with a lot of you on the panel today in the past as well. And some of your good friends, colleagues, some of you are my mentors, and I've taken a lot of inspiration from. And moving forward, also, I think it is the collaborative efforts of all of us that actually will go a long way in shaping the diagnostic industry in this country. So without wasting much time, Dr. Sanjay, you have been my mentor. I've always looked up to you. I actually take a lot of inspiration from not only the great success that Suburban has had in the country in the diagnostic space, but it was only the other day that I was discussing with my wife, sir, and I was showing your Instagram account to her. And I was telling her that how does sir find time for this 2 weekly sessions with his fitness trainer, and how is he cooking waffles on a Sunday morning? I mean, after I work Monday to Saturday 12 hours a day, Sunday all I do is sleep in. So again, I'm super inspired by the work life balance that you show, sir. And it has been very, very interesting to follow you also. But just coming to the topic of this panel discussion, and that obviously the last year has involved a lot of suffering. The entire world has been through the tsunami of COVID, and hopefully, keeping fingers crossed, we would have probably been through the worst of it. But, sir, according to you, uh, with all this suffering around us and everything that happened, I'm sure there's a silver lining in this dark cloud. There are a lot of things that probably in the long term there have been learnings, there have been a lot of experiences that we have personally gone through. The diagnostics industry and the labs themselves have had a huge learning curve. So your point of view on this, sir?
So, Arjun, thank you for those very kind words. I think the feeling is mutual. I have been admiring you for the last maybe 10 years that I've known you now, and you're just growing in strength. So the feeling is absolutely mutual. So thank you for those kind words. I think we can have a full day session if we were to talk about the learnings of the last 1 or 2 years of the pandemic. Uh, I think let me start by saying I think the pandemic really exposed one is the gaps that are there in the healthcare industry across the planet. That where are the gaps really, but it also showed the resilience of the healthcare industry in being able to step up and fill those gaps very rapidly. I think gaps in technology, gaps in skilling, but were compensated by agility. I think that was perhaps the balancing act that was there. That I think technology, the ramp up of technology that has happened, both in terms of accessibility to our customers as well as technology within the lab for testing, both have seen a dramatic ramp up. Things which may have perhaps happened over the end of this decade have been really fast tracked. I think if I look at accessibility, for example, every lab today now has an ability to create a digital access point for its customers or its doctors. That this, I think, the whole digitization that we talk about, would have happened gradually, but I think that has really seen a very dramatic ramp up. Some of us probably were doing it earlier, but I think across the industry, this whole ramp up has, been tremendous. And similarly, I think with the demand within the labs for testing, I think the agility that was shown by the labs in being able to ramp up and the whole uptake of molecular diagnostics, which is actually a very future looking technology for all of us. I think all of us eventually would have been part of the molecular diagnostics framework, but this pushed us into that for the right reasons. So I think these were the two perhaps big, the positives: the whole digitization as well as the uptake of technology within the lab for testing. I think the ability of skilling gap that was there, because there was so much of demand, we needed to rapidly fill that demand by skilled manpower. I think that gap still remains. There was some agility shown where we were able to get people, but I think that's an opportunity which all of us can definitely look forward to. And I would say last but not the least is this whole, what I call is democratization of healthcare, where the ability for people to choose healthcare objectively for the right reasons, because of this whole digitized platform, the whole democratization that has happened has been a huge, the positive for all of us. We can continue speaking, but I would love to, have others share their points as well. Thank you, Arjun.
Thank you, sir. So, Anindya, coming to you, and hashtag the new normal, or the latest meme that was doing the rounds, that negative is the new positive. I mean, COVID has changed a lot. And now that the industry has to live with it, and especially the diagnostic industry, that we never really thought could have metamorphosized over 1 year this much. And actually, if you ask a lot of veterans, probably pre-COVID, they had thought that this industry has matured. But I think over the pandemic, there are so many innovations, so many newer things that are happening. What according to you has the industry imbibed over the year, and what would it be to live with COVID moving forward?
Thank you, Arjun, for that question, and thank you, and greetings to all of you for this for coming onto this panel. I think the last 2 years have taught the diagnostic industry a lot. I mean, what we have learned in the last 2 years, we may not have learned in the last 10 years. And today, I don't know whether it's by coincidence, but today we are ending 2 years of the launch of the lockdown. All of us remember 24th March 2020. So it's actually a good day for us to reflect as to what we have learned. And yeah, I'm right. Sanjay sir did reflect very properly on how we have learned, and we have to live with it. It's part of life we have started life like we have learned to live with SARS. We got to live with COVID will come, and at the same time we will also have to ensure that patient care continues and improves across the entire spectrum. So for example, looking at how, I mean, one of the things that we have learned, and that actually COVID helped us learn, is how so many labs, especially the RT-PCR labs, can get NABL audited in 2 years. I mean, that's a huge amount of labs. At least for the RT-PCR section, they got the NABL audits done. So that's really exposed the entire consumer patient to the phenomenon called enable compliance. I think over time it's very important for the country to also understand, and the diagnostic industry to move towards a much more compliant form of testing, because like all of us know that even today there are many labs which do not have the enable accreditation. But I think it's now the patient, it's now the consumer who will start asking for such compliance in quality, because compliance in quality is one area where definitely diagnostic industry will be moving forward. That's one clear outcome is what I see. The second outcome, of course, is that because of the lockdowns, because of the pressures of working from home, the whole environment has changed, and now convenience becomes even more important to the people of today, to the patient and the consumer of today. Be it home collection, be it everything available at the tip of a finger on a mobile app, be it wellness packages, because even in these times people are now become much more health conscious, stuck at home. They have taken to a lot of health regimes, and also hence wellness packages become extremely important going forward. Hence convenience as well as healthcare, own healthcare becomes important, and patients are now going to take a lot of decisions on these fronts, and hence we will have to, as an industry, be geared up to meet those requirements of the people. And finally, of course, at the same time, we have to also understand that RT-PCR has become a very, very common lingo, common language. I'm sure 2 years back, much lesser number of people even had heard of what's RT-PCR. And like correctly what Dr. Sanjay sir said, that molecular diagnostics is now going to become more and more important. And yes, RT-PCR is, COVID-19 might be just a very small part of molecular diagnostics, but molecular diagnostics will continue to, maybe not in the next 365 days, but definitely in the next 3 to 5 years, that is going to become a crucible in which most of diagnostic organizations are going to be measured at how good are you in molecular diagnostics. So I think these 2 3 trends clearly emerge as learnings that we have from the last 730 days. Thank you, Arjun.
Great, and they're very, very nicely put, and I like it how we've actually focused on convenience to the patient. At the same time, that keenness for good health, I feel, has really gone up. I mean, even if you look at the whole wellness initiative that the labs took in the past, say 5 to 7 years, now that actually inherent want of being healthy, because obviously COVID through the 24 months has shown people how delicate human life is, and that even the healthiest of persons have lost their lives and have gotten infected, have had very serious infections. So Dr. Pankaj, coming to you next, and obviously the last 2 years that we've discussed, there have been a lot of things that have changed, a lot of things that the diagnostic industry has learned, a lot of new innovations that have happened. But according to you, what was the crux of the last few years, and any interesting points that you would guide us to take ahead with us?
Uh, Thank you, Dr. Arjun. Uh, I think COVID has taught us, all of us, so many things. Uh, at least now expectations of patients are more from us, from pathologists. They require TAT faster, earlier the report you give, digitization they want. uh, all the home visit segment also, it's grown up, and now even for small tests also they feel that home visit is preferred. So slowly I think everybody must have experienced. I think Dr. Sanjay will agree with me. When we started in 80s, we had never thought of such type of scenario. And digitization was never a in on our thought also. But due to COVID, I think everybody has gone into digitization. So improving access of both patient and health providers to deliver things are more important. And now everybody enables reports from remote monitoring of the patients. So at the same time, patients, giving patients ownership of their health and wellness is also a part of it. Uh, Increasing accuracy and standardization and efficacy is part of it. So, actually we have to, what I have learned is leveraging artificial intelligence to better integrate and analyze healthcare. Like, see, we during COVID, we used to do so many blood tests, like we know that D-dimer, all those, IL-6. So there were so many predictive parameters also. So one thing good about COVID, of course, it was bad for everyone, but for a patient point of view, yes, people have become more health conscious, and they are up to date in their knowledge. So that in fact we also feel that we should be also up to date with our whatever we have to sharpen our knowledge also, and they are always interactive with you. So this is what has helped us.
Great. Thank you, Dr. Shah. And certainly, I would agree that the patient's expectations have definitely climbed up, and even the physician's expectations from labs. And but what we should not forget, obviously, is that obviously when you and Sanjay sir started, and it was actually an area where there was a lot of focus on quality, a lot of focus on service, and obviously a mobile app or a technology platform or any kind of AI was obviously in the back seat. But now I think the time has come, and especially youngsters like Mohit and all of us to start embracing that change also. And Mohit, coming to you. So actually, I was hearing somewhere, and they say that adopting technology is like changing the wheel of a moving car. And I think in legacy organizations such as yours and all of ours, I think it's very difficult to actually convey the vision of the management to the entire staff to adopt that change in technology, embrace it, learn it, train your fellow staff members, and then ultimately actually make it live for the patients who actually end up benefiting from it. So Mohit, from your perspective, obviously the learnings in COVID, and how did technology play a role? And with the huge volumes of RT-PCR testing also that your lab was doing, I mean, the entire process of data entry and the SRF generation till the time of the report upload on the ICMR portal, etc., etc. How did you really leverage technology, or any interesting anecdotes that you would like to share? Mohit, you're on mute.
Thanks, Arjun. Yes, you're pretty much right about bringing about any changes in any legacy organization. First of all, because all the lab technicians with whom you're working day and night, so they are pretty much used to working on the status quo, and they present any change in machinery or change in the software that we use. So it takes a lot of effort to bring about any change. That is pretty much bang on that you hit the spot on right over there. And to be very honest, the pandemic helped all the organizations, I would say, to change things, because suddenly everything changed. So everybody was, accepting towards all the changes that were coming. So, of course, the pandemic, brought about a lot of volumes to every lab, not just our lab. I would say every lab was loaded with a lot of volume, and certainly the manpower had reduced to half, to be very honest, because most of our staff was getting sick at the same time. So, technology was absolutely a necessity at that point of time, and thanks to the tech guys, a lot of innovative solutions came across, which solutions like API integrations, and integration with the ICMR website, and bulk registration of patients, inventory optimizations through technology. These solutions really helped us work twice as hard as we would have otherwise been able to manage these things. So yes, technology did play a big vital role in this pandemic fight that we were all in. And speaking on that, Dr. Pankaj was saying that the expectations of the patients has really climbed up, and we actually feel like warriors in the midst of pandemic when we were working day and night over there. So yes, to be very honest, the pandemic has increased the pride quotient in me for the job that we are doing. So that certainly has increased for me. And I believe the pandemic would also do post the pandemic. the importance of having an insurance would have also increased, because India still, about 60% of the healthcare expenditure is done out of pocket for India. So there's a huge gap that the insurance sector has to plug in. So I believe this pandemic uh, has really pushed forward the need for having an insurance. So I would think if the insurance sector grows, so the diagnostic sector will also grow because of it.
Great. Thank you, Mohit. Very relevant points, and I do agree with you on most of these points. We'll come back to you again and probably discuss a little bit more about tech and other things that helped us get through the pandemic. Sir, Sanjay sir, coming to you. Yes, you
I
have a
just wanted
point.
to add a couple of points at
Please,
the end that,
please.
I think the biggest outcome from this has been, we are all part of the diagnostic industry. I think the the focus that the diagnostic industry has got over the last 2 years, it has been unprecedented, and the focus for the right reasons. I think that perhaps is, according to me, a very big significant outcome from this, that the importance of diagnostics in management of any patient. I mean, and I think the pride that all of us feel that we are part of the diagnostic industry is another thing I think that has sort of brought a lot of unity among the diagnostic companies together. That we are in it together. We feel that sense of pride, and we also feel that sense of focus, or the limelight being shown on the diagnostic industry for the right reasons. I think these are all, according to me, very good takeaways for all of us as well.
Certainly, sir. The focus has been unimaginable, and sir, coming to you for the next question. So actually, what one thing that has really caught our notice, and I'm sure all of us have discussed otherwise, is that through COVID, I still remember when there were hardly a handful of labs that were processing COVID RT-PCR tests in the beginning, and over a few months, this number was increased to a to another magnitude, or there were more than 1,000 or 2,000 labs processing RT-PCR tests. So there have been a lot of labs that have done great work, but also at the same time, the importance of a correct report is obviously paramount. And at the end of it, when you actually look at all this hustle bustle in the diagnostic sector from a bird's eye point of view, and these innumerable labs that have mushroomed up, I feel that from a regulatory perspective, to maintain that level of quality in the reports, because at the end of the day, it's all about the quality of the report and the patient. And from a regulatory perspective, sir, what would you advise that can be steps that can probably be taken in the years to come? Because at the end of it, it is only that patient and his management, a majority of which depends on that piece of paper with those figures that we give out.
I think Anindya touched upon this point very well, that the agility shown by NABL in remotely bringing accreditation to any lab that wanted to get into COVID testing. I think that is a big learning for all of us. That if if that is a possibility during a COVID when we were pushed to the wall, how can we make that standard of operations for every lab today? I think that perhaps will bring about a huge change in the right direction. That if NABL, all uh, the criteria for accreditation are adopted by every lab for the right reasons, and not merely as a roadblock, but more as a facilitator to ensure, as you said, that everybody is performing tests in the right environment, with the right equipment, the right technology, the right team, following the right protocol. I think it will just overall raise the standard of testing in the industry across. I think this perhaps is the biggest uh, outcome from the pandemic, at least for India, that how can we use this uh, initiative taken by NABL to bring about regulations for, as you said, 2,000 plus labs in the country, and that also remotely. How can we do this on a more continuous, on a consistent basis across maybe the 150,000 labs that exist in our country? and raise that standard, bring a minimum quality standard across all labs in the country. I remember when I started the lab almost 3 decades ago, there was a big hue and cry because there was a a mandate for making sure every lab in Maharashtra should be NABL accredited. And many people sort of were up in arms that we will fight a case. We came together and everybody said we will hire a lawyer. Of course, nothing happened in that. But if I look back and I think that was actually a move in the right direction. That if you bring in standardization, if you bring in regulations, you are creating the right kind of entry benchmarks for every lab, and not just entry benchmarks, but even consistently moving ahead in their journey. So it will overall, I think the standard of healthcare will become much better. So this perhaps for me is a big, huge takeaway.
So I couldn't agree with you more on this, and also with this NABL accreditation, I think so. What's very important, and also from a patient's perspective, is that not just any lab with the NABL logo means that the particular test that's being performed for them is accredited. So every NABL has a particular scope of tests, and the patient should actually inquire about, okay, is this test under the scope, or is this lab performing this under the NABL accreditation or not? So actually, that is again something like people actually come to me and they say, so what is the difference between your lab and some other lab where they have the same logo on the letterhead? So it actually gets difficult to explain to them that majority of our tests will be under NABL's purview. So Anindya, coming to you, and like Sanjay sir was saying, there's been a lot of focus on the diagnostics industry, and it's obviously for the good, not only from a healthcare perspective but also from an investor's perspective. There have been a lot of consolidation that has been going on in the sector. And earlier, when it was probably survival of the fittest, now it's probably survival of the biggest. And also looking at that and how important is scale really in today's diagnostic industry? Any emerging trends of the industry that you'd like to elaborate upon? Anything else that you'd like to comment on, Anindya?
Yeah. So in terms of that's a very valid point you're talking about. It's an industry where there are going to be a lots of moves and shakes. It's inevitable, and it is may not be the survival of the fittest, but it could be survival of the widest. By widest, I would say the diagnostic centers which have the widest reach in terms of ability to reach out to patients, reach out to clinicians. I think that is something which is going to be extremely important going forward, because patients are, like Dr. Sanjay sir said, the patients are now much more conscious. Quality benchmarks have come up, and patients do realize that labs need to have a basic minimum standard, which is in India is still the NABL. So labs which have a maximum number of NABL labs, labs which can provide service at a doorstep, labs which are also working in the same environment where every single thing is available at your fingertips on your mobile, and if labs are adapting to that, those are the labs which will actually stand out, and those are the labs which will be able to really make much faster progress going forward. So simple things like, if I'm able to access my doctor, because during the pandemic, one of the biggest new things that started coming up was that doctor consultation on phone. I think that's something that all of us went through, and it's something that's a trend that started. So if doctors can get consulted on the phone, I mean, I can very well do my ordering of tests and get my reports on my mobile. So I think that's a convenience factor that patients are really used to now, and labs which are up on the yardsticks on that, they will really be able to prosper better. At the same time, it's another very important thing is that are the labs able to meet a large menu of tests? Are they able to provide me the complete the complete set of tests that I want to? So I think that's another thing. And I think Dr. Pankaj also touched upon a very important consumer orientation factor, which is the turnaround time. People needed tests earlier in 24 hours, in 36 hours. They were okay with it. But now they have learned that some things can come in 12 hours, some things come in 6 hours. And like the recent raging debate which has been going on in the last 2 days about Zomato giving things in 10 minutes, which is I'll reserve my comments on that for another day. But here definitely people know that they can get the test in 3 hours, in 2 hours. Why can't we get it? So I think these are certain trends that people will demand more service. People will demand in shorter time better quality. So there will be no compromise on quality, and the time required will be given to us will be shorter. And the lab which is able to meet these requirements, they will obviously be able to survive better. So that's what I meant by survival of the widest, when they have the best services and they can also provide these, they can meet a wide range of customer requirements. One of the other things that I would like to also point out is that the last 2 years and going forward, patients have become very aware that of their own health. So it's very important, if as a diagnostic organization we are able to connect to patients, be it any forum, but we are able to connect to patients and we talk about how we care for them. And caring does not mean only providing packages. Caring could mean actually sharing with them information, sharing with them health tips. These are things that, if and they are used to now getting such information on the digital platforms. But if there is an organization, if the diagnostic organization which is actually actively participating in all such forums and actually disseminating information without any apparent commercial objective, blatant commercial objective, then I think those organizations also will stand out, because today people do understand social responsibility, and they connect to organizations which demonstrate a better social responsibility. I think these are some of the things that are that comes to mind when it comes to the new trends that are emerging. Thank you, Arjun.
So Ananda, again, you hit the nail on the head, and I completely agree with you that scale is definitely very important. That last mile delivery, especially considering that a majority of the country is in tier two, tier three, and in rural areas. I mean, that capability to deliver a test and give a report within the stipulated time, even in a tier two, tier three city, I think that is something that we have to focus on. And definitely 10-minute testing is definitely not possible, but I think yes, all our collaborative efforts towards should be towards giving the best, the fastest, at the lowest rate. And so Dr. Shah, coming to you, and actually Sanjay sir was also mentioning about the huge capacity ramp up that has been with the RT-PCR testing and the molecular biology. And I still remember about a decade back when the swine flu pandemic had started, and that time there were hardly any BSL 2/3 facilities in the country, and there were a few labs that actually ramped up the infrastructure and started doing the H1N1 testing very soon as the government mandate came out. But now, over the past 1 year, if we actually look at it, there have been crores and crores that have been invested in these biosafety level 2/3 facilities. And like I was just checking yesterday, and our number of COVID tests that we are performing is probably maybe 1/30th of the amount that we were processing during the recent wave. And obviously, while wrapping up infrastructure, all of us had the combined goal of actually helping the citizens of the nation to test quickly, get a quality report. But now, what about all that infrastructure? So, not only infrastructure, the machinery, the equipment, the manpower. Then even on the tech side, there have been a lot of additions to the lab itself. And we do consider ourselves a hotspot, India being a hotspot for infectious diseases. There are many of these new tests that can be started up that are actually required in the mall bio lab. And any other tips or guidance from you, how this extra manpower and infrastructure can be utilized better for the benefit of the people of this nation?
I think, see, so far we were depending on ELISA method to detect, dengue or malaria or leptospira or what, all infectious diseases. Since everybody has now, you know, due to COVID, outbreak, everybody has infrastructure and staff, and all of them have done so many tests for, RT-PCR COVID, and they are on hands-on, and they have acquired a lot of accuracy also. So I feel that entire this segment should go into infectious disease should go into PCR base. So that will be the infrastructure also will be utilized and staff also will be utilized, and plus there is accuracy. So there is no if some cocktail of some certain tests are one panel is made for one infectious disease, that so multiplexing PCR and those things are going to really take the future.
Sure, sir. I completely agree with you. The serology-based tests that we have at the end of the day is indirect evidence, and then may it be a Lyme's or a leptospira or a chlamydia or one of these infections that we are testing. Obviously, a molecular biology or an RT-PCR will be more accurate, and obviously will guide the physician to start the treatment immediately. So that is a very relevant point, and also I think more of collaborative efforts again on absorbing the manpower also, that was definitely there to maybe to run the RT-PCR tests. But now that all of us will plan on expanding our molecular biology menu, I think there are a lot of things that go in that, especially like what Anandya was saying about raising awareness, about having relevant medical content out there for the masses to actually understand, and also the physicians to understand what a PCR test can give vis-a-vis a simple ELISA or a serology test. I think that is also crucial. So Mohit, coming to you next, and obviously it's been great the work that all of us have done in the past years, and but I think there is a certain need of innovation now, with so much of investor interest and focus on the diagnostic industry. For you as an organization in the past years and the years to come, is there some innovation that is in the pipeline? Is there something that you are planning, or just for me to put it simply, is what is the vision that you have probably for the next few years? And there are a lot of these online aggregators these days who actually give a promise of integrated health. Is that something that you're moving towards or planning to move towards, and what do you think about that?
Thanks, Arjun. Yes. Speaking about that, obviously the competition is very tough with these online aggregators increasing day by day, I would say, and both on the price front and on the market share front, the competition is getting intense. So, to be very honest, increasing footprints for a smaller lab diagnostic chain like ours is a little difficult given these circumstances are there. But however, we've been lucky enough to grow our footprints nevertheless. And vision forward, to be honest, is collaborating more and more with the government, like serving more and more the panels of government, because we strongly believe that the spend from government side is definitely going to increase post pandemic. As in, we can already see that the percentage of the spend on GDP on healthcare from the government has increased. And nevertheless, since India is becoming a developed nation every year, we move forward. So going by the GDP spends of a developed country on a healthcare is India still lags behind a lot, but India is still catching up. So we strongly believe that if we align ourselves with government programs, government PPP projects, we will be far better off, and in that way we'll be able to increase our footprint as well, not only in Delhi NCR, which is currently right now, but pan India as well. So that is clearly the vision for us.
Great, great. I think Mohit, your point about working with the government and PPPs and to enhance that infrastructure that is already there in government labs and government setups, I think is a great initiative, and it will be very interesting to work towards this similar goal that all of us have. So, Sanjay sir, back to you. So, actually, my next question, I need your help for me to frame it better. But all of these data analytic experts always tell us that, oh, you run a lab chain, oh, you're sitting on a gold mine of data. Now, obviously, we have decades and decades of patients coming into us, getting tested, and obviously, those lab reports are there in our LIS. So, firstly, explain to our viewers here and to all of us, why is this data a gold mine? How do we actually use this data to give actionable insights to the patient? And at the same time, also, what's always puzzled me is that in 1995, the patient who walked in, and I was just 5, 7 years at that time, but who walked in and came to our lab, we still have that person's data. But then, what about the privacy concern wherein that data is confidential? That patient never gave us consent to use that data to develop an AI algorithm, or for us to use it, draw a conclusion, publish it, commercialize it into a medical device, nothing at all. So what actually goes in understanding this big data better, and your advice on how all of us should approach this?
That's a big question, Arjun, and I'll try and see how to articulate that. Let me start by saying I think COVID itself gave us evidence on how, I think Mohit spoke about APIs being, developed by all labs to share data with ICMR. I think that perhaps was a great insight into how uh, consolidation of data across the country allowed better decision making by the health authorities of this country. I think getting the positivity data showed which states are showing a higher trend, where is in the hotspots being developed. And I think it was allowing the government to take, or the health authorities to take, very quick decision making based on real time data that was being uploaded. I think so. COVID actually has given us an, sort of a little bit of a taste of that, what is in store. But some of the questions that you raised are very pertinent, especially around data privacy. So I think there is still, I think the jury is still out there about, I think the data actually belongs to the patient, and we definitely need patient consent to be able to use this data. But however, I think there are some views on anonymization of data where demographics are hidden. There is no name, gender, or name or age or any other identifier of the patient which is anonymized. And I think what I think is that perhaps all the labs that are here, there are five of us today on this panel, all of us will have data in some format or the other, but perhaps this data will not be in a synchronized format. So I think first is to bring data in a synchronized format, and I think the National Digital Health Mission aims precisely to do this. I think by creating a unique health ID for every individual in the country, almost akin to the Aadhaar, and making data standardized across the country. This will allow what I call is interoperability. So someone who has done a test from Dr. Dang's lab goes to GCC and gets a test done at Aster Labs. That interoperability becomes very easy. So there's no reason for us to, redo the test, or not sure of what the data was there and how do we bring it here. So standardization and interoperability are, I think, two key tenets of how the data can be used. I think the data privacy laws will have to be evolved, and all of us will need to, be very cognizant of the fact that if we do have to use data, and we have to explain to patients that this data will be used for critical insights to bring better compliance, to disease trends. Um, like we had used data of urine culture reports to understand what is the drug susceptibility pattern prevalent in our backyards. So there are so many use cases of the data. COVID, truly, like I said, is one such example. But I think a lot of work still needs to be done. But I'm glad that the National Digital Health Mission has taken that initiative. I hope all of us can support and try and accelerate the outcomes from that.
Absolutely. I think this topic deserves a separate session on its own, and it's really for novices like me to learn about how actually this data can be utilized for the best, because this is a gold mine. But I think we need the right direction and the right regulatory laws also to guide us what is actually doable and what is obviously legally not possible to do. So I think
But on the
very
contrary,
interesting
here, I
space.
think, yeah, Arjun, on the contrary, it's the digitally native people like yourselves who will teach us how to use data more effectively. I think it's exactly the other way around. I mean, people who are digitally
Definitely.
native, who are born with an iPad in their hand or a mobile phone in their hand, for you, data is so much more seamless. I think it's a reverse flow of information here, where you will sort of lead the light and showing us how can we use data more effectively.
Definitely, definitely, sir. I think that is for the years to come and very interesting times ahead. And they're coming to you. So again, we've all heard and spoken about integrated health. Now, integrated health for some people is like a mobile app where you can do a doctor's consult, where you can book a lab test, where there's an e-pharmacy. Some people, for integrated health, for some of them is like a wearable device where you have an Apple Watch that will detect your vitals, that will give you reminders about what to do, will give awareness tips. But I think the integrated healthcare approach, the initiation of this idea was that so that the patient is at the center, and all these things from primary till tertiary care are revolving around the patient. So, Anindya, as per you and heading Aster Labs, that is an internationally renowned organization, for Aster and for you, what really is integrated health? And what are the steps that we can take in a country like ours to reach that goal quicker and in a better way in the years to come?
Yeah, so integrated health, it's a very, can I say, a holistic question, Arjun, and I'll try to answer that to the best of my abilities. Uh, Being part of a larger organization, which is Asset DM Healthcare, I've also been exposed to a bit of what is integrated healthcare, and that actually helps me trying to address the question. You're right. Integrated healthcare actually puts the patient in the center, and then all the different elements of health across the entire spectrum, be it from preventive wellness to surgical interventions, maybe the entire gamut should be around and focused on the patient's requirements, focused on ensuring that the patient gets this healthcare with minimal inconvenience and at the lowest possible cost, so that he gets the best quality at the best possible cost that's available for him. And that's where integrated healthcare also means a large penetration of insurance. I think Mohit touched upon this point. So integrated healthcare no longer actually is isolated to the domain of healthcare providers like ourselves. It also includes payers nowadays, because somebody has to pay for the treatment, because that's how the whole world has moved. So in my view, integrated healthcare is a place, is an environment. It's not really a one-stop shop. It's not really a one-stop shop solution, but it's rather an environment in which, for the patient, with least amount of inconvenience, the patient has access to wellness, to basic primary health care, to diagnostics, to secondary care, and if required, quaternary care, and of course, to follow it up all the way through to pharmacy, and all the way through to even physiotherapy if that's required. And then somebody and somewhere the integrated healthcare the setup actually enables the patient to also subscribe to insurance which can pay for all of this, of course in different limits of in different limits. But it's a environment that needs to be created. We are quite far from that. And I think in one of the points you did mention about, it's important that for us to understand that uh, there's an India and there's a Bharat. There's a tier two and there's a tier three, which is also extremely important to us. We saw during COVID that earlier, prior to COVID, RT-PCR used to happen most probably in the top 15, 20 cities. But now RT-PCR does happen down below, even in tier two and tier three cities. So it's time for healthcare also to penetrate. And when I say healthcare penetrates, patients can actually sit in Kottayam. Patients can sit in Tirunelveli, and in front of a screen, patients can actually walk into a center, and using technology, patients can actually interact with specialists in any city. See, samples can always come, but interacting with specialists over technology is something that we have learned in the last 730 days. So, in the integrated healthcare setup, it is technology which is going to play an extremely important part, be it radiology, be it consulting, and of course pathology can be given over can be couriered across samples. But the entire perspective is healthcare with a backbone of a robust technology, and with a complete support from, let's say, a payer network, which could be the insurance setups, is what I think in the years to come is what a patient of India, and definitely a patient of the world, would be seeking. And we have to work in tandem across, not only within the diagnostics domain, but to reach out, and we have to reach out to the government as well in some cases. We have to reach out to to NGOs in some cases to provide this kind of a setup. That's when health in India will really be something which will be at the fingertips, not only of a mobile app, but also it will be at the fingertips of the common man in tier two, tier three, tier one cities. That's what I believe the future of healthcare setup, healthcare infrastructure should be like.
Definitely, Anindya. I think more than anything else, coming from a brick and mortar kind of traditional setup that labs used to have, and obviously labs now will look at having feet on the street, but at the same time, building that ecosystem that brings care and convenience to the patient, no matter if they're in a Mumbai or a New Delhi or a Bangalore or a Hyderabad versus any of these tier two, tier three villages, rural areas that you're talking about. I think is indeed the need of the hour. So coming to Dr. Pankaj, and sir, actually, I have a very candid question to ask you. I have a very candid question to ask you, and I still remember. So I discussed this with my father also, who founded the lab. And initially, when they founded the lab, both my parents, they actually for the first few years they had a big board outside the lab. I think Sanjay sir knows about this. They had a big board outside the lab that said, "We don't offer home collections. Even if you ask for a home collection, we won't offer you a home collection, because the sample is best processed when I draw the sample myself, I run the sample myself, and I report the sample myself under my guidance." Obviously, that model is definitely not scalable, but at your age and stage, at my father's age and stage, I think that is what the ethos of the entire industry is ought to be. That cornerstone of any high organization, healthcare organization, has to be that trust and empathy between the doctor and the patient. Since long, pathology and a lab has always been the back end healthcare kind of a industry, where it's just that sheet of paper with those written values coming out. But I think obviously changing with the times obviously has been extremely essential. But also with these multitude of labs coming up, with these investors jumping in and saying, okay, let's pump and dump, let's pump 100 crores, make it 300 crores, and be out in 5 years or 7 years. I mean, somehow I feel that the industry is certainly getting commoditized, and senior stalwarts like you I'm looking at you to give guidance to youngsters and novices like us about no matter how much we embrace technology, no matter what we do, that basic trust ethos and that focus on the patient to give them the absolute best quality should be at the helm of all our priorities.
Yeah, certainly. See, entire landscape of healthcare industry has changed now. There is no more a patient and doctor relation. See, it was. I still remember when a patient used to walk in with fever, they used to tell, "You do whatever you want to do, but I want diagnosis. What my fever is due to what." So onus was on me that I have to save his money also, and I have to give him diagnosis also. So that type of concept was there, but then, as you rightly said, this you cannot scale it up. So there, personalized people are there, personalized, services are given. So I don't know, for a youngster, I think uh, with this type of scenario, they have to get together and have some group practice, like they can have a multiple center, and there has to be some centralized processing unit. This will help youngsters in, but there also it is limited to probably one city or a district or a some state, but it cannot be a national level. So this is what my take on for my view, that if anybody from panelists have some different view, please share.
Thank you. Thank you, sir. So Mohit, over to you. And any comments that you want to add or any remarks on this conversation? And then probably we are running out of time. So you can probably have the concluding remarks or any points that maybe I missed out on and you would like to elaborate. Please do contribute.
I just like to say that you touched upon a very interesting topic of the enable scope. So yeah, yes, definitely the awareness about the scope should also be increased. And also, I remember as a child seeing the ad of an ISI mark, that pick a product of an ISI mark only. So some kind of advertisement from any NGO or a government body should come for an enable accreditation as well. And gradually, yes, the awareness about the scope will also increase. One interesting fact that I've seen is that the government has started taking notice of the scope as well. Like few of the recent PPP projects that are being launched, I'm having a close look on those. So the requirements of scope, how many tests are there in the scope. So importance is being given on that. So that's a very positive trend that I'm seeing, which will actually encourage people to get in more and more tests under the scope. Otherwise, a lab which is just having a CBC in the scope and a lab which is having like 200 tests under the scope are all looking the same right now. So incentives should be given to the lab, who's having more and more tests under the scope. But however, another opposing view is that to be very honest, NABL accreditation and maintaining that is not as cheap as one would think. Getting every test under the scope requires a cost. So, with mushrooming of so many labs in our country, with so many labs operating at very subpar revenue level, incentivizing them to come under the NABL accreditation and getting more and more tests under the scope. I think the cost factor of that should also be worked upon from the enable body and from all of us together. To be very honest, because the more cheaper it becomes, the more at least many labs who are just discouraged just because of the cost that is involved to get more and more tests under the scope. So at least that discouraging factor would be negated, I would say. And lastly, I would also touch upon one more topic that is very dear to me, is about the issue of the mental health. So right now, it is mental health is the most ignored topic in our country, and in diagnostics, I would say that there is no solution that probably we have in a measurable, point of view for diagnosing the mental health. So I would like technology to advance more upon this topic, so that in future we are also able to measure and diagnose the mental health of a patient as well. So because that can be a game changer.
Great, Mohit. Again, very pertinent points. And unless any one of the panelists have any remarks to make, I think we are drawing to the close of the session. And a very, very heartfelt thanks for this very interactive discussion. And I look forward to staying connected. And I think all of us agree on one basic thing on which we can close this session is that diagnostics actually needs to be democratized with digitization and efficient delivery moving forward, and with our combined focus on giving the absolute best to all our patients. Over to you, Kanchi. Thank you so much.
Arjun, thank you so much for a great session. Thank you, Arjun.
Thank you.
Arjun, thank
Thank you.
you. A wonderful
Thank you,
Thank you,
Arjun.
Arjun. Thank you so much
Thank
for
you.
a wonderful.
Thank you.
Thank you.
Thank you so much, Dr. Arjun Dang, for your wonderful moderation, sir. And I thank all the panelists for their insightful views. And we would like to inform our esteemed gathering about our upcoming events, which are the 4th Pharma Leadership Summit on the 26th and 27th of April, 3rd Radiology and Imaging Summit on the 26th and 27th of May, and Medical Education Summit on the 23rd and 24th of June. We look forward for your constant support in future. I once again extend my warm gratitude to all the panelists for their time and presence, and please accept a small token of gratitude from our end through these certificates that we present to Dr. Arjun Dang for his wonderful moderation. Thank you so much, sir. Dr. Pankaj Shah for his insightful views on the discussion. Thank you so much, sir.
Thank
Dr.
you.
Sanjay Arora for his views. Thank you, sir. Mohit Lalchandani for his keen points. Thank you so much, sir. And Anandya Chaudhary for his points. Thank you so much, sir. Thank you, gentlemen. It was really great listening to all of you. Thank you.
Thank you. Thank you so much. Thank you.
Thank you. Thank you.